are you? Today we are completing the part 1 of hyperthyroidism. This is part 2. In the another presentation, we talked about definition, sign and symptom, and some important things about hyperthyroidism. Today we speak about another thing. If you have sign and symptom of hyperthyroidism and you neglect it, unfortunately it leads to a serious problem in your health, such as heart disease. Maybe the patient admitted to coronary care unit without any problem in his or her heart, but the problem in the hyperthyroidism which he had, or stroke, osteoporosis, infertility. Maybe the person be pregnant or sometimes has abortion, cannot complete all trimesters of pregnancy. Now, maybe you ask me how we can diagnose hyperthyroidism. As we said, we have many clinical manifestations or many signs and symptoms of hyperthyroidism. First thing about taking full history. The physician or the nurse should take full information about the patient's history or sign and symptom of the patient, or physical exam, because the patient, if has a goiter, we can see it and we can detect it by eye vision. Ultrasound to detect enlargement of the thyroid gland. Some blood tests, especially for detecting level of thyroid stimulating hormone T3 and T4. And also we can diagnose hyperthyroidism by CT and MRI scan, especially if we suspect the thyroid gland by tumor. Now we are talking about treatment of hyperthyroidism. Unfortunately, hyperthyroidism, because it's an autoimmune disease, as we said, one of their causes is Graves' disease. As we mentioned in the previous presentation, Graves' disease is autoimmune disease. Immune disease in the body will be mad and attack the thyroid gland, and that leads to secrete much more thyroid. Because it's autoimmune disease, we cannot prevent it at all. But if the patient affected by hyperthyroidism, we can do some rehabilitation for the patient, especially for weight loss, for fatigue and weakness, bone thinning, impaired nutritional plan, and taking calcium, vitamin D for the patient, and regular exercise can help to improve bone and heart health. They are essential to the patient, especially if advised under the physician's order. Also, for those patients who has ophthalmopathy, I am as a nurse, I advise those patients wearing sunglasses and applying cool compressors, using lubricating eye drops, and raising the head while the patient is sleeping to relieve pressure in the eyes. But pharmacological treatment such as antithyroid drug to block the gland's ability to make hormones, and radiated iodine to damage the cells that make the hormone. If we cannot treat it by this medication, the physician try to do surgery for thyroid gland. Thank you very much for listening. I hope it will be helpful for you. Thank you very much.